Good morning, Broward County. Thank you for joining us today to hear about Project Opioid Broward. I'm Bob Swindell, President and CEO of the Greater Fort Lauderdale Alliance, the public-private partnership for economic development for Greater Fort Lauderdale, Broward County. We focus on creating, attracting, expanding, and retaining high-wage jobs and encouraging capital investment in high-value targeted industries, working to diversify and strengthen our economy. And through our Greater Fort Lauderdale Alliance Foundation, we support and lead initiatives to develop more vibrant communities and improve the quality of life of our area's citizens. And it's through our dedication to these focus areas that we are here today. We're here today because opioid overdoses have become the epidemic within the pandemic. Think of this: someone dies of an opioid overdose every 2 hours in Florida. Each day, one person loses their life from an opioid overdose in Broward County. You may be wondering, why is this message coming from the Greater Fort Lauderdale Alliance Foundation? Well, beyond the personal tragedies that this data represents, opioid abuse also threatens the health and economic fabric of our community. The opioid epidemic has reached its addictive tentacles into all segments of our society. Income levels, racial and ethnic groups, professions, and neighborhoods. And it's rapidly evolving from the traditional pain medications to heroin, and most recently to cheap and deadly synthetic drugs. These synthetic drugs are far more deadly and prevalent than their predecessors, which means more lives lost and greater health and economic impact. And this is our business. While dozens of organizations and thousands of people work on the front lines of the opioid battle, and we are grateful to their steadfast commitment to this crisis, there has never been a coalition of business, faith, and philanthropic leaders formed to educate themselves and the public and advocate for solutions that could save many, many lives. You know, this exercise reminds me very much of our homeless initiative that we took on with Kathleen Cannon, the United Way, a few years ago. The business community, myself in particular, learned a lot about the homelessness issue and the mental health aspects and the leading causes of homelessness. And, you know, it went from a perception that people just did not want to work and wanted to live in a camp to really understanding that brain trauma injuries, other things like that, often precipitated homelessness. It really educated the business community. And it was with that understanding, when Florida Blue Foundation approached us, that I understood the business community really needed an education on this issue. The pandemic has more than pushed out any other health concern over the last 18 months. But as we're hearing more and more about the opioid crisis, it really brings it front and center, and really we need to get the business community inspired and create a call to action. Today we'll learn more about this epidemic and what it means for our community and the plan we have to step up and fight the crisis. You're going to hear from Kathleen Cannon, my friend and longtime colleague in many, many issues. She's president and CEO of the United Way of Broward County. And Kathleen's going to share the opioids have become a raging and epidemic in our community. First through prescriptions of oxycodone, and then the increased use of heroin, and now the introduction of a highly deadly fentanyl, a synthetic opioid. She will also discuss the impact COVID-19 has had on the opioid epidemic within our community. But you'll also hear some promising solutions today from our co-chairs of this initiative and from other influential leaders in our community about the steps we will take moving forward to save lives. And later in this program, we'll be joined by Andre Bailey, the founder of Project Opioid, for a question and answer session. If you have questions anytime during the program, please enter them in the chat section of the webinar, and we'll work to answer as many as we can. Or if you'd rather like to volunteer to be involved, please enter your contact information in the chat and either contact myself or Ron Brew. Hopefully, 1 hour from now, we'll have motivated you to let us know how you want to join the team to reduce opioid overdoses and save lives in Broward County. To start off, I'm pleased to introduce Penny Schaefer, the market president of Florida Blue. As market president, Dr. Schaefer is responsible for the company's business operations in an 8-county region from the Keys north to the Treasure Coast. Prior to joining Florida Blue in 2006, Penny had a distinguished 26 career as a senior executive at AT&T, holding positions in sales, service, quality management, and global operations. She serves on the boards of more than a dozen area community, civic, and professional organizations, and is a frequent speaker on issues of healthcare, leadership, sales, and civic engagement. And she's been a past chair of the Alliance and other influential organizations. And Penny was influential in working with me as we reshaped some of the structure of the Alliance during her term as chair. I have a tremendous amount of respect for her professional wisdom and her ability to lead a business organization. She holds a Bachelor of Arts in Public Science and Political Science, rather, from Frostburg University, and an International Executive Master of Business Administration from Fordham University. She also holds a PhD in International Business Administration from Kennedy Western University. Ladies and gentlemen, it's my honor to introduce my good friend, Penny Schaefer.
Thank you, Bob. Appreciate that. And thank you all for being here. This is the first executive briefing for Project Opioid Broward. And as Bob mentioned, I'm Penny Schaefer, and I have the privilege of serving as the market president for South Florida. First, I want to tell you why I volunteered and why Florida Blue is so interested in this particular effort and why we funded the effort. You know, the pandemic combined with the loss of work, the social isolation, has really led to increased rates of depression and anxiety, particularly to those who struggle with addiction already. And as a result, we've seen a heartbreaking increase in the overdoses and overdose deaths linked to opioids. In 2019 alone, 545 people died of opioid overdoses in Broward. That's 545 911 calls, 545 EMS responses, 545 police reports, 545 families devastated just in 1 year alone, and solely in Broward County. That's before the pandemic isolation, and the numbers have risen precipitously. Broward unfortunately leads the state in fatal opioid overdoses, outpacing both the state and country's averages. It's devastating, and we've got to fight the lives lost and fight for the lives still before us. For years, we've been committed as Florida Blue to fighting this growing epidemic. We started in 2017 as the first insurer in the state and only one of a few across the country who stopped covering highly addictive OxyContin. We've taken other measures in our health role in the community to try and reduce the amount of addiction with new policies and new procedures. But we also recognize this has got to be a community effort. The community was already addressing it through amazing means, and we applaud the organizations that had already stepped up to the plate to provide assistance. But what we did recognize is that we needed to do more and a broader coalition that included business, philanthropic, and faith-based organizations to continue the movement. So again, we applaud the efforts and we'll work collaboratively with those who are already working on the front lines, but we need the coalition to come together and bring the strength. Our Florida Blue Foundation has literally given millions of dollars to programs that are on the front lines of this crisis. Those efforts include preventive as well as educational programs in schools, certified peer recovery specialists, in emergency rooms, and in hospitals. In 2019, we launched Project Opioid in Central Florida because we knew collaboration was the only way to move the dial. We also knew it would take efforts like this around the state if we were going to make substantive reductions in opioid-related addictions and deaths. And so our CEO, Pat Garrity, personally committed our company to play a leadership role in significantly reducing the number of opioid-related fatalities in Florida. In partnership with Florida Blue and the Florida Blue Foundation, Project Opioid is tapping established regional business development boards like the Greater Fort Lauderdale Alliance to create collaboratives to bring together business, faith, and philanthropic leaders with those who have long been on the front lines to educate our communities and to save lives. By expanding the program to major regions, we're able to partner with even more of our state's top business leaders, the champions, if you will, in announcing similar programs in Central Florida, Jacksonville, the Tampa Bay area, and of course here in South Florida. As mentioned before, opioids don't discriminate. They can take over the lives of the rich and poor, Black and white, young and old, executive and labor. They can destroy families and friendships and business relationships. And that's why we remain focused on doing our part to fight the battle to win for these communities. It's imperative that we work together to find ways to help those in need so they can live their lives free from the grips of addiction. Together, all of us together, 93 of you already on this broadcast today, and those that you'll bring to the coalition beyond, we create better, healthier tomorrows for our community. So as I've said, we're putting significant funding behind it, and we've committed to bring the leadership and the support to Project Opioid Broward. We've approved the creation of this initiative, and I'm encouraged by how quickly the effort is getting underway. During the months ahead, we will keep doing the deep dive for all the available data to understand the scope of the problem here in Broward, to understand the root causes, to understand the initiative. We'll be researching and presenting a comprehensive view of the treatment services and resources that are available. We'll be recruiting our coalition of business, philanthropic, and faith-based leaders. If you want to lend your name, you can do that in the chat, or you can outreach directly to any of us. It is your time, it's your resources, it's your attention, it's lending your voice to an important voice to all of us. By this time next year, we will have developed a go-forward strategy complete with specific goals and accompanied by a data dashboard that will allow us to measure these programs and hold ourselves, our leaders, accountable for results. And we hope you'll join us. Now, I'd like to turn the program over to our own Kathleen Cannon. She's the president and CEO of United Way of Broward County. Kathleen is a tireless leader who is always fighting for health, education, and financial stability for every person in our community. We know United Way of Broward County has for many years had a commitment to combating the opioid epidemic through its United Way of Broward County's Commission on Behavioral Health and Drug Prevention. So this is a part of the collaborative that we need to build to support the efforts in place. And it's my pleasure to introduce our own Kathleen Cannon.
Penny Schaefer, thank you so much. And boy, does Florida Blue step in all the time in all kinds of crisis. I do want to share how deeply you're stepping in right now with the Surfside catastrophe. So want to thank you for that, for this, and so many other things that you do. So I'm going to give you some statistics, and at the end, we'll certainly have questions and answers, but together we really can tackle this. It's an economic issue, but oh boy, it's a human toll issue as well. So I'm going to really be talking about the state of the opioid situation right here in Broward County with some numbers that you've already heard, but they are shocking, and I'm going to review some of them. Broward County has been a hard-hit region of the overdose crisis fueled by opioids, as shown by Project Opioid's data and data collected from the Interim Medical Examiner's report. Opioid-related deaths increased 31% in all of Florida and 70% in Broward County between the first half of 2019 and the first half of 2020. From the first preliminary medical examiner data to be reported last year, it was clear that Florida suffered from a big spike in overdose deaths, especially in May 2020. But Broward County, we suffered a double spike in both April and May of 2020, with numbers likely to be continuously revised upward as more overdoses are confirmed even a year later. Project Opioid's data last year showed 71 overdose deaths in April 2020, a 51% increase from 2019, and 78 overdose deaths in May 2020, a 73% increase from 2019. Now, these were peak pandemic mitigation months. The pandemic was hard on everybody, and if you certainly have an addiction, it was greater for those folks. Now, up to 86% of overdose deaths involve an opioid of some kind. And according to the state of Florida, fentanyl occurrences went up 70% in 2020. Fentanyl is a synthetic opioid 100 times stronger than morphine and is most commonly manufactured, obtained, and used illicitly. Despite its incredible potency, non-pharmaceutical pharmaceutical fentanyl from foreign clandestine labs is significantly cheaper for street dealers to obtain than other drugs such as heroin and cocaine. In the first half of 2020, including these peak pandemic loneliness months, there were 308 deaths attributed to fentanyl in Broward, compared to 177 in the same time period in 2019. Again, this represents a 74% increase in deaths from fentanyl in just a 6-month time frame. Meanwhile, the driver of the so-called second wave of the opioid epidemic, heroin, actually decreased in use and overdoses. The driver of what we call the first wave of overdoses, prescriptions, also did not cause the increase in deaths, as the prescription painkiller Oxycontin and oxycodone did not increase usage during the pandemic. Methadone, which many of you have heard of, it's a tightly controlled prescription used to treat opioid addiction. These overdoses decreased by 14% in Broward County. Observers were watching very closely methadone as the regulation of its use was relaxed during the pandemic so that patients and doctors did not have to come into so much contact with each other. However, although those decreased, while deaths attributed to fentanyl were up 74% in Broward, occurrences of fentanyl were up 70% as well. Now, an occurrence is when a specific drug is present at the time of the death of an individual, but not necessarily the direct cause of the death. Since fentanyl is so cheap, it is so much cheaper than heroin and cocaine, significant multi-drug use occurs without people even knowing it. People do not even know that fentanyl is in what they are taking. Increasingly, dealers are cutting their products or reducing the purity of other drugs they are selling by inserting fentanyl into the drug. Now, here's a new stat. In 2021, new synthetic opioids, even stronger than fentanyl, are found in contaminated street drugs and deadly counterfeit medications. These fake pills look so realistic that even experts cannot identify them by sight. We are all keeping a tight eye on this. Now, in addition to soaring opioid overdoses, cocaine and meth overdoses have increased as well, as a rate comparable with the increased rate of the fentanyl occurrences. During the first 6 months of 2020, 195 people died in Broward, where cocaine was the primary cause of death, but other drugs, and of course, most commonly fentanyl, were in the system at the time of the person's death. This was a 64% increase from 2019. In fact, in 2020, for the first time ever, fentanyl passed alcohol as the most common drug in the bodies of people who die of an overdose in Florida. That is drastic change. Now more than ever, people who buy drugs illicitly are at a greater risk of unintentionally dying of opioids that they've never even heard of, and they don't know that their drugs are cut with these. Only 1.8% of opioid overdoses were classified as suicides in 2020, with well over 95% classified as accidental deaths. The people dying do not want to die. The potency of fentanyl, combined with the effects of the pandemic, has caused a dramatic increase in the number of deaths in Broward County. Opioid use and overdoses have a profound economic cost as well. Penny had really talked about the families, the folks, the coworkers, et cetera, of folks who have died from overdoses, but there's economic impact. And this is where we as a community come together so often, where business joins with nonprofit to tackle big social issues. According to varying estimates from the federal government and American Action Forum, opioids could be costing Broward County alone $462 million a year. Now, this is such an added economic cost to the human toll that we just talked about. United Way of Broward County has been working to address this devastation of addiction and substance use disorders for many, many years. We have a deep commitment to this issue. We welcome this new partnership through Project Opioid Broward with businesses, faith, philanthropic leaders, and together we can make a difference. And like Penny said, we are going to ask you to join this effort with us. Together, we can make a difference, put in sound strategies, and make sure that we are allowing people to live and not die, and helping them with their addiction issues. So I want to thank you for having us. Bob, I am going to go ahead and turn it over to you, and we'll look forward to questions at the end from everybody. Thank you.
Thank you very much, Kathleen. And thanks again for the outstanding work the United Way Broward County has been doing in behavioral health and drug prevention. I think the staggering statistics that you just shared really put a point on why the business community needs to get motivated and needs to become more aware of what's going on. It just has not gotten the recognition within our media that it truly deserves. This is a crisis in the making, and it does have an economic impact on our community and our businesses. We look forward, and I look forward to partnering with you and Project Opioid as we have done on so many other projects. I want to move now into hearing from our co-chairs. I'm going to begin by speaking on behalf of Lisa Lutoff-Perlow, fondly known as LLP. She is the CEO of Celebrity Cruises. She's also an active member of the board for the United Way of Broward County. And so Kathleen and I work very closely with Lisa. You may have read and seen that we're very excited that the first cruise ship leaving Florida, and actually the first cruise ship leaving Port Everglades specifically, was a Celebrity Edge. So it's one of Lisa's ships. And she is obviously involved with that. And we're totally supportive of the work that Celebrity is doing, and recognizing the cruise industry is coming back. It's an important economic driver for Broward County and the state of Florida. But Lisa asked me to pass on a message to everyone. My dear Project Opioid Broward supporters, I am so sorry that I couldn't be with you today as co-chair of this year's endeavors. After 15 long months, my very own Celebrity Edge has the honor of being the cruise industry's first ship back in the water in the U.S., having met all the standards for providing a healthy and safe cruise experience for its guests and crew. The ship is sailing this week on our first cruise from our very own Port Everglades, and the timing is such that my energy and efforts needs to be focused on our successful return to service at this time. It has taken tremendous focus and intention to bring us to this day at Celebrity Cruises. And the parallels with the opioid challenge we face are not lost on me. We need the same dedication and commitment to raise awareness, develop the strategy, and steer the resources to combat the opioid crisis and achieve success as we did to navigate the pandemic. I'm honored to be co-chair and look forward to working together with all of you to make important strides in improving the situation for the health of our state and our collective employees, friends, and families. Together, I know we will chart a course to smoother waters. Thank you, Lisa. I appreciate those comments, and thank you for your commitment to Project Opioid. I'm now pleased to call on our second co-chair, Mr. Shane Strum. Shane is president and CEO of Broward Health, one of the 10 largest public health systems in the United States. He most recently served as chief of staff to Florida Governor Ron DeSantis. Prior to his work with the state, he served as senior vice president at Memorial Healthcare Systems in Hollywood. Before he joined Memorial's executive team, Shane served on the South Broward Hospital District for several years, including 2 terms as chairman. A native of Broward County, we are very, very happy to have him back in Broward. His legacy of public service has spanned nearly 30 years. During that time, he has led initiatives that have lowered the cost of prescription drugs, expanded telehealth services, improved transparency and quality in healthcare, and increased awareness on mental health and substance abuse issues throughout the state. In addition to his healthcare experience, Shane has excelled in higher education, having served as vice chancellor of Kaiser University and director of corporate and government relations at Nova Southeastern University. Many of you have worked with Shane in the past. We are so thankful to have him back in Broward County. We have been friends for many, many years, and I treasure that friendship. I'm going to turn it over to Mr. Shane Strum. Shane? And Shane, you're on mute.
I just pulled a Bob. How do you like that? Maggie was teasing about that a little earlier. Well, what I was saying was Really, thank you, Bob, for the kind words. You've been a great friend for many years, and I can tell everybody that you fought every single day for Broward during COVID. What was pretty amazing is that you did not sleep one bit. You continued to think about what are the solutions that we could be doing here in Broward. You continue to push the needle, not on making sure that businesses are here, but this is a great example, Project Opioid, making sure that also the health and well-being of our community is well taken care of and watched. And I've had a pleasure of working with Andre. I heard several people kind of talk about the project, the program, what it's doing, its statewide approach. And, you know, we were fortunate in the governor's office. We had a champion in the governor, but also the first lady. And she really took a strong role, and she really went out there and crisscrossed the state and shared the story about mental health and substance abuse. We've talked about these issues. Andre could go into it a little bit more. I know we spoke beforehand about how critical the role is of his organization, but also the sheriffs across the state. I know we have Sheriff Tony, phenomenal to have him on board and helping us out, and Sheriff Lima, who was leading the charge with the First Lady when they were introducing it into Central Florida. You'll hear a little bit more about that a little bit later today, but I'm just happy to be here to be able to really kind of talk to you about new solutions to the opioid crisis. The use of opioids has significantly, in fact, impacted many families in our community. Here alone at Broward Health, we've long recognized the complications that can be associated with opioids. Which is why we here at Broward Health put in protocols to manage their usage. So our physicians, our doctors, our hospitals have a much better understanding along with any of the clinicians. Really, another program that we have is called, I don't know if you've heard of it, it's called Project. It's really alternatives to opioids in the emergency department. And it's really a way to educate our pharmacists and physicians just on kind of like a couple of key measures that were introduced a while back to reduce the exposure of opioids. So again, that's called alternatives to opioids in the emergency room. But even despite that tremendous effort and our caregivers' efforts, as you've already heard from Kathleen, and I mean, Kathleen does tremendous work. She's always out in the community. Her organization really not only raises awareness, but raises countless dollars and helps organizations like ourselves with money and with message. And I know that she's worked really hard to kind of talk about how can we reduce really the exposure to opioids. And that's a big measure being taken on here at Broward Health. But really, despite the tremendous efforts, we just have to continue to work harder every single day. We continue to treat our patients that require naloxone. That's used to reverse. A lot of you know what that is, the opioid effect. So if somebody does come in or is encountered, paramedics, pharmacists, healthcare can actually apply that. Our pharmacy has successfully initiated, probably, it's been a little while now, a new project called naloxone dispensing program throughout Florida. It actually has been looked at and reviewed so favorably that we've now been listed on the isaveflorida.com website. I'll say it again, just in case anyone hasn't looked at it, but it's, I had something written down. Let me see if I can find it here. But it gives you some interesting facts on, and Andre probably know about it. Let's see here. So we have iSave Florida. It'll help you with naloxone, finding it. It'll help you with overdose for education, how to find treatment, how to get involved, prevention, resources. So Broward Health and Broward County will now be able to be part of that iSave Florida website, which I think is important for people to jump on. Really, I'll tell you some other scary stats kind of bouncing off what Kathleen talked about. Since March of this year, we've dispensed hundreds of these naloxone kits, which is crazy, right? Hundreds. They have to come here, fill forms out, and do that. And of those hundreds, we continue to assist them. And really why we're helping them, this is to kind of break from that opioid addiction. It doesn't just affect the person, but it affects their loved ones. It affects their children, their parents, friends. Everybody suffers as a result. And so really, I'm happy to be a part of this council. I'm happy to help in any way I can. Really, treatment and preventive actions can provide a meaningful and life-saving solution for all of us. But what we really need at the end of the day, Bob, is really the entire community's input. We can't say it enough, but as leaders and everybody that's around the table and everybody that's really on this Zoom today, how do we consider the best actions? What are the next best steps we can all do? So just know that Broward Health is pleased to offer its insight. We've got a lot of physicians who have a strong expertise and background in this. We want to be a part of the dialogue. And I really believe that working together, we can really bring about meaningful change for our neighbors. We can achieve some of the goals that you'll be hearing about from others and really better well-being. So thank you for having me on the panel today.
Thank you very much, Shane. And thanks again for not only your friendship, for stepping up. I know you have a lot on your plate as the new CEO of Broward Health, but it speaks volumes about your commitment back to your hometown and helping us out with this project. When you think about the folks that are on this call, whether it's Lisa Lutoff-Perlo, Sheriff Tony, or Shane, or Rosalind Osgood with the school board, large employers as well. And that's part of the messaging that the business community needs to help with is get the word out to employees, and so folks can help family members, neighbors. We need to take some of the stigma away from this issue. And I think as you all represent large employers, I think part of the success of this project is going to be getting the word out to the folks that work for different organizations with that throughout Broward County, public employers and private employers both. We're thrilled to have our third co-chair, Sheriff Gregory Tony, serving as our sheriff for Broward County. Sheriff Tony's dynamic and progressive leadership has transformed the BSO, Broward Sheriff's Office, into one of the most accountable, progressive, and respected public safety agencies in Florida. As Broward's 17th sheriff and the first African-American to serve in this capacity, Sheriff Tony brings a wealth of experience, unique skill set, and passion for public safety to BSO. Growing up in inner city Philadelphia, Sheriff Tony learned from an early age the determination and focus that is needed to be an effective police officer. He experienced firsthand the prejudices that exist between minority youth and law enforcement, and the difference that must be made in order to change the negative perceptions. As sheriff, he has used his experience as a launching pad to implement forward-thinking policies to better connect with the many diverse communities BSO serves. Sheriff Tony established his home in the Sunshine State when he moved to Florida to play football at Florida State University under the leadership of legendary coach Bobby Bowden. That's a Gator saying Bobby Bowden. That's just something that's just hard for those words to come across these Gators' lips. But he was a legendary coach. Sheriff Tony graduated from FSU with a degree in criminology and later received his master's degree in criminal justice from Nova Southeastern University. He is currently involved in as a doctorate student at Nova Southeastern University. He was earning his PhD in criminal justice. I'm now proud to introduce Sheriff Gregory Tony. Sheriff Tony.
Awesome. Hey, good morning, everyone. Thanks, Bob, for the wonderful introduction. And, this is really, really exciting because a private-public partnership is what it's going to take for us to start impacting this crisis we're having here. Of course, as the chief law enforcement officer in the county, I'm most certainly, closely and intimately involved with every single encounter when we're talking about the crisis in terms of how this is impacting Broward residents. I can tell you over the last 2.5 years, a lot of the figures that was just read off through Kathleen and others, it's not shocking for us. We know it, we live it. And we've had to take some drastic steps early on to try to mitigate the harm, not only to the community, but to my personnel. For those who are not familiar, just a quick reminder, the Broward Sheriff's Office is very unique in that we also have fire rescue under my command. And so we're getting it on both sides, whether it be law enforcement deployed in the field, having to use Narcan to resuscitate people, the exposure that my men and women are coming into direct contact because of, related to the lethality of this drug. And then you roll over into having to call fire rescue to do the medical transports and further treatment. We're getting exposed there. But there's also one quiet element that we don't see as much in the news, but it's also an exposure within our jails. Whereas inmates are seeking to, penetrate our systems of security to bring in drugs into the facility. And so we've done some things to help get us prepared. But again, I'm excited to see this partnership because there's going to take a huge educational push to get out into every aspect of our community. And we can't do that alone. Just to give you an idea of some of the things that we tackled looking at this crisis from when I came in back in 2019, roughly not too long, probably around September, we start realizing these spikes and figures were going up and seeing more of our men and women out in the field performing CPR or dealing with people who are going through, these phases of excited delirium and the responses to this narcotic. And so we started to work and introduce Narcan into Broward County. One of my director Dave Sharf, who's on here today monitoring, led up this project to ensure that we had a surplus of Narcan that came into the agency, so much so that we were able to push out and disseminate it to all law enforcement across the entire county, despite whether or not they were under, BSO's jurisdiction. So Fort Lauderdale, Coral Springs, everyone benefited from this particular, push and distribution. And so we have it out in the field. Our law enforcement personnel are using it. Of course, our fire rescue personnel are out there deploying it. But the thing I've always talked about is that is retroactive, right? If we're deploying Narcan, the hurt, harm, and impact on society has already happened. The idea is to get to a point where we can mitigate it so we don't have to use Narcan out in the field. And that's where the education is going to come in. That's where the partnership is going to come in. That's where we're going to have to be really creative. Another step that we recently taken to help mitigate the harm to the community and, of course, my first responders was another huge project that we just launched, roughly a couple months ago, whereas our Director Sharp over Community Programs had did an enormous amount of research to look at what can he do to introduce technology in the field that would help reduce the exposure when we think we may be examining cocaine, but in today's current climate, it's not just cocaine anymore, it's fentanyl. And so we introduced a piece of technology called the MX908 baseline technology that we can deploy in the field, in the jails, through a fire rescue, and take a quick swipe and sample size of whatever that substance may be. And this machinery can really identify thousands of different variations of drugs. And that's been helpful. And we're looking to introduce more of that type of technology in the field. I think that's an early phase, and we're probably one of, I think, 2 different counties or maybe 3 in the state that took this initiative. We procured roughly 4 of those different platforms or systems. They ran roughly $90,000 a piece. We'll continue to, invest in it. I see it just being something that's going to be essential for us. Really quickly, again, welcome back to Shane. Shane and I spent the last 2.5 years on the phone. So what? He was in Tallahassee, but we literally spent the last 2.5 years on the phone, whether it been COVID, whether it been school safety, whatever it may have been, police reform, and he has never forgotten where he has come from. He never forgot Broward County, and I think it's great that the way the world works, sometimes it's cyclical. You thought you were gone, but we got you back, baby. All right, and we're happy to have you, and I know we're going to do a good job working together. With that, I say this, Bob, brilliant to start pushing this off and bringing a team together and getting BSO involved. I think having a large public safety voice will also solicit more of a response from our municipal city police departments and our municipal fire rescue departments out there. And then, we're just going to spread this thing like a virus and have some real good success out of it. So I'm short in commentary today, but I'm just looking forward to the continued negotiations and conversation about what we need to do.
Sheriff Tony, thank you very much. I'm going to enjoy working with you on this project. This is a huge lift we're all taking on, but when you look at the 3 co-chairs that are leading Project Opioid with Lisa Lutoff-Perlo, Sheriff Tony, and Shane Strum, there's no way we're not going to be successful as a community. While the numbers are staggering, I think we've got a leadership team put together and we've got some great professional guidance. And then we have a phenomenal resource in the United Way of Broward County that they've been working on this issue for years. And, fortunately, as a community, we've got the United Way as part of that backup. So really appreciate everyone's comments so far. As we, the Alliance, have gotten involved with Project Opioid, we've been learning more and more about the people we know that have personally been affected by the opioid epidemic. Their personal and business losses are heartbreaking and many. Today, we are joined by the Honorable Jennifer Webb. Jennifer is a former state legislator for House District 69 over on the west coast of Florida. Voted one of the most effective freshman legislators, she also earned the National Alliance of Mental Illnesses Legislator of the Year Award for her work in behavioral health. She's a founding partner of Omni Public, a global strategy, public affairs, and public relations firm specializing in deploying new concepts, new technologies, and new enterprises. Omni's clients include innovators such as Tesla Hyperloop, Immertech, and Project Opioid. Actually, Jennifer is the director of Project Opioid Tampa Bay. Her experience in health and human services extends to her board service. She serves as secretary of the Bay Pines Veterans Administration Foundation Board and has recently been elected to the board of the Gulf Coast Jewish Family and Community Services Council. Jennifer isn't here today to speak with us about policy. However, she's here to share with us her family's story, a heartbreaking story of how the opioid addiction touched down into her family and forever changed them. Please welcome Jennifer to the screen.
Thank you, Bob. I'm glad to be here today. And although the statistics are quite somber, the life-saving solutions and the leadership in Broward are just have buoyed my spirits. And I hope that it's very much encouraged those in this meeting, in this virtual meeting today, to reach out and to get involved. I'm here with you today to share my family story and the story of my baby sister, Allison Grace. Allison was just 19 years old when she died. She was a freshman at Louisiana State University, sorry Gator fans on the call, who worked as a daycare teacher and at a local preschool. She wanted to follow in my grandmother's footsteps and become an elementary school teacher. She was spunky, mischievous, big-hearted, and a defender of the underdog who was the glue of our family. She loved music, animals, and adored our nephews. Allison and my other brothers and sisters and I grew up going to Sunday Mass with our parents and attended college preparatory Catholic schools. I know my siblings would agree that our fondest memories were those we made as a family: LSU football games together with friends, piling up on our parents' beds to scratch backs, Independence Day at the camp at Falls River with our extended family, and our many treks to the beach. Memories, both big and small, we carried into college with us, but Allison carried more to college. Allison's struggle began her senior year of high school. Where did a high school student get turned on to opioids? Straight out of a scene from an after-school special, one of her friends took some leftover OxyContin from her grandmother's medicine cabinet and distributed them around to their friends. Allison got hooked. And a little over a year later, she was facing serious consequences from LSU, and she wanted to get clean. So she reached out to me for help. Sissy, that's what she called me. I think I have a little problem, she said, drastically understating the situation. I brought in my parents, and after much convincing, because she thought she knew what she needed to do, we checked her into an inpatient program. Allison begged us not to tell anyone. And honestly, we weren't very inclined to tell anybody ourselves because at the time, my parents didn't know anyone in their circle who had children suffering from opioid or substance use disorder. So we worked with the professionals quietly to get Allison help. Unfortunately, at the time, the life-saving interventions that were mentioned today and are commonplace were still seen as experimental back then, and our bias deterred Allison from using them. We had dealt with addiction in our family before and thought she'd make it through. But Allison kept relapsing and feeling full of shame. And I kept reminding her that recovery is a process and it involves stumbling. But on December 20th, 2013, struggling to get sober again and full of despair, Allison shot herself. As my spouse, my mother, my father, and I were running to save her life and screaming for her to put the gun down, Allison pulled the trigger. We were too late. We were too late to save Allison, and each and every day families are too late to save their loved ones. So as personal as this tragedy is, the purpose of this story is to shock you into action because my family is not alone. After Allison died, we found out the many parents and business colleagues who had children suffering from mental health struggles or substance use disorder. We heard the heretofore silent stories of children who had lost their lives or overdosed. Of course we did. The truth is that 136 families each and every day in the United States lose a loved one to a fatal opioid overdose. That's 136 families broken each and every day. How can we not act? I have joined this initiative to save lives so no other family will have to face such tragedy. I choose to share my family's story so that no other family suffers in silence. And I'm happy to be joining y'all today. And I'm so proud of Project Opioid Broward.
Jennifer, thank you. And our condolences. I mean, I'm sure as you tell this story, you're reliving the tragedy that you shared with us. But thank you for sharing that, because you're right. If there's no other call to action, it's hearing your story. And as we've gotten more involved with Project Opioid, more people have come forward. And I think to your point, we need to remove the stigma from addiction and from the mental health issues that contribute to these overdoses. So thank you very much for sharing your story. And we look forward to working with you statewide. I know you're motivated. You've had a personal, impact from opioids, but folks like you really inspire the rest of us to get involved and to make a difference. So thank you.
Thank you, Bob.
Our next speaker is one of the truly inspirational leaders in our community, and we're so pleased to have her with us today. Dr. Rosalind Osgood is a Broward County native and is a graduate of Fort Lauderdale High School. She currently serves as chair of the Broward County School Board. But Dr. Osgood and I go back a long ways. We first became friends working through the American Red Cross. She's always had a big heart and a commitment to this community. And I couldn't be prouder when she joined the school board, representing all Broward County residents in one of the most important endeavors we have as a community, and that's educating our young people. Dr. Osgood has earned both a master's and doctoral degree in public administration from Nova Southeastern University. In 2001, the late preacher extraordinaire, Dr. Matt King Carter, licensed Dr. Osgood as the first female preacher in the history of Mount Olive Baptist Church. In 2002, she was ordained, and in December of 2007, she earned the Master of Divinity degree from the New Orleans Southern Baptist Theological Seminary. She currently serves as an associate minister at New Mount Olive Baptist Church. In addition, she is founder of Dr. Rosalind Osgood's Ministry International, as an anointed itinerant preacher. You'll have to explain to me what that is one of these days, Dr. Osgood. Dr. Osgood has over 21 years of experience in nonprofit management. She is the CEO of the Mount Olive Development Corporation for the past 16 years, one of the many leaders working on affordable housing in our community. And she served on numerous boards and committees. In 2013, Dr. Osgood became the first female chaplain for the City of Fort Lauderdale Police Department. She has received numerous awards, including the 2009 JM Family African American Achievers Award for community service. Please welcome Dr. Rosalind Osgood.
Thank you so much, Bob, for that introduction. And it's always good to work with you and continue to do the work of our community. And I'm so glad my friend Shane Strum is back home. Shane and I had our times and years together at Nova, Huizenga School of Business. And thank you to Sheriff Tony for the tremendous work that you're doing. And Ms. Webb, thank you so much for sharing your personal story. December 2nd, I'll have 32 years in recovery, one day at a time. So as we talk about drug addiction and substance abuse and the things that addicts experience, it is a disease that's not treated like any other disease. But with the help of the community and our families, we do recover. Shane, today, this conversation is public administration at its best. We have law enforcement, we have the hospital district, we have the business community, we have Kathleen Cannon and the fabulous work that she does at the United Way. That's my sister from the other mother. And we have our grassroots organizations, all of the community coming together to solve this dramatic problem. The overdose crisis that we see today is not impacting everyone the same way. Young people, those in challenging economic situations, individuals who have experienced traumatic life experiences, and those who have lived in generational poverty, all experience the highest rate of overdose deaths in 2020. And yes, we have to pause a moment, and it's difficult to think about the babies that are being born in opiate withdrawals. And then those babies are then placed in foster care. The rigorous commitment towards creating more inclusive access to successful treatment options and expanding pathways to care are vital. I also personally feel that education is vital. We need to help our community understand these different medications that are often dispensed to them by a source who's supposed to care for them and treat them. Every person in our community deserves equitable access to care. and barriers to treatments must be overcome to give each and every person the opportunity for transformation. I'm a living example that we can and we do recover. We must create new frontline and new coalitions of advocates made up of the faith community, the business community, philanthropic leaders, all of our community influences. This is one of those things where we need all players on deck. It's kind of more of a football setup, Sheriff Tony, than a basketball setup. In basketball, you have 5 people on the court at one time. Football game, you have to have 22 on the field for offense and 22 for defense. So this is more of a football setup. And maybe we need to start running a whoosh back format where we have 3 persons in the backfield as we got this committee set up with our co-chair.
Now she's talking my language.
We must help create new conversations that are culturally appropriate and facilitate connections to support those who feel the chasm separating them from the help that they need when they need it most. We must be very intentional about reaching in our community to those persons that are oftentimes not at these types of tables, the people that are under the trees, the people that we see hanging out on the street corner, those persons that are at high risk for addiction and putting these types of drugs in the hand of our children. I heard it mentioned earlier as Ms. Webb was speaking about her sister and how she had gotten the opiate from it being left in a cabinet of someone else. Many of us sometimes go and we get medication and we don't use it, but then we don't properly dispense it and we just leave it there. And we never think about when a child goes to the bathroom or something that they could remove it. As a matter of fact, we don't even keep account of what it is. That's a part of the education. The leaders here today will help launch cutting-edge advocacy that encourages those suffering to seek help. Families, loved ones, and the community at large need readily available information that provides clear instructions on the accessibility to all treatment options in their areas. And those instructions cannot just be online. People that live in communities like I live in still have problems with internet access and stabilization of internet. So whatever we do, we must provide options that are not online. And there is simply no place better to reach those who might be at risk or family members who need solutions for loved ones struggling than in our most trusted institutions. The congregations, our churches, our mosques, our synagogues, corporations, community groups located throughout our region offer us a perfect opportunity for trusted engagement. This battle to save lives must engage all of us, business, faith, community, philanthropic leaders, in a very collaborative framework. I just completed this program at Harvard Kennedy School where they talked about Professor Heifetz and this adaptive problem-solving model, where you bring all of the experts and the leaders in the community together, and we join together, engaging in developing a strategy that would allow for treatment and care that will be provided within our community. We believe that every person afflicted by opioids is worthy of the best efforts of our community that we can offer with this new frontline. And this is the answer that we've been searching for. We must give urgent attention to this segment of our community. People can recover, and they can recover and do great things and become key leaders in a very valuable part of our community. And that's coming from my heart, because I know how hard addiction was to me and the relapses and the struggles and being arrested. But having access to community programs, the church, family support, it helped me get the strategies in place that I need, 12-step meetings and programs. It helped me deal with the stigma of being, an addict or an alcoholic. It provided me the resources, BARC really saved my life. but it was a community effort, one thing at a time, whether it was daycare for my kids, me needing to go back to school, counseling. It was a community approach, my church, that helped me rebuild my life to where I am today, that I can serve in our community and not be arrested and not use drugs and alcohol one day at a time. So these kinds of things do work. So we must use our church pulpits, our school healthcare courses, our corporate HR departments, and all of these key places that we live and work and play become a new daily opportunity for those to reach those in need. All of our neighbors, all of our families, they really deserve this fighting chance. Thank you for the work that's already being done in the community, but this is our opportunity to level up together to truly make our communities a better place to live, work, and play for our children in the next generation. Thank you.
Thank you, Dr. Osgood. Thank you for sharing your personal story as well. You and I have known each other a long time, and you are an inspiration and really a great example of what can happen after addiction. And addiction is like any other chronic disease, and that's the way it needs to be approached. So thank you, Dr. Osgood. And thanks for all you do for Broward County schools and our students. I'm now pleased to move into the conclusion of today's program. I'm pleased to introduce an individual who's truly been a crusader in the fight against the opioid epidemic in Florida, Andre Bailey of Project Opioid. Andre has established and led some of the most prolific organizations that exist to help the homeless within our society. Some of you remember working with Andre when we tackled the homelessness issue in Broward County. Andre's unique approach is solving social problems in an approach that is characterized by collaboration, and you've heard that today throughout the presentations. We have some questions in the chat, but I'll turn it over to Andre and take it away, Andre.
Bob, I'm going to explain to you later on what a faith anointing is that Dr. Rosalind has. Dr. Rosalind, my background is I've got a master's in divinity. So I'll school Bob later on what that means, just so you know. So we've only got a few minutes left, but I just want to say this to everyone out there. I'm just going to take 2 minutes, kick it back to Bob. We want to be cognizant of your time. A few things you need to know, and I'll just answer one key question here. Joe in the chat was asking, how can a business leader be involved, and why should a business leader be involved? And let me just quickly respond to that question as I kick it back to Bob to conclude this webinar. And that is, number one, this is some high fancy charts I've got here, guys, but this is the chart from the Department of Health of deaths that have happened. These red lines are the death rate that has happened since the pandemic. And those blue and gray lines, we'll actually send this to everyone. Those represent historic numbers before the pandemic. But we have seen, and this is why Kathleen and Bob and Shane and Sheriff, and Dr. Rosalind and everyone is really urgent about this. We have seen the death rate accelerate since the pandemic in a way that we've never seen before, not just in Broward County or South Florida, but around Florida and around America. We're seeing a mental health crisis that has connected with this new drug fentanyl, and it is killing people at a rate we've never seen before. So there's an urgency. The second thing I want to say to you, Joe, and other business leaders out there is, just like Jennifer helped us do, we've got to put a face on this struggle. If you look at statistics, you miss it, in my opinion. Kathleen, the numbers you were talking about, almost 70 people per month by the time we have all the numbers counted in Broward County. 70 people a month are going to die of overdose in 2020, representing upwards of a 50% increase. But this is millennials. These are folks in the Black community, the Latino community, that are seeing the highest increase in deaths. This is a generation of young people and those who are vulnerable, who aren't trying to die. They're not just making bad choices. They're people that have gotten themselves in a situation that's bigger than them, and they need help. So if we put a face on this accelerated crisis, it gives us, again, that urgency, Joe, for business leaders to get involved. The last thing I would say, and I'll kick it back to Bob, is this is a solvable crisis. some of the things Shane was talking about earlier, putting naloxone in people's hands, helping people get medication like MAT. Some of you might not know what that is, but there are FDA approved medications you can give to someone who's struggling with these drugs that will keep them from overdosing and help build a bridge for them to recovery. So there's so much we can do in businesses, in churches, in philanthropic circles to come alongside our public sector, our elected officials, come alongside those who have already been working on this and help drive new strategies and new resources to make a difference on this crisis. And Bob, as I kick it back to you, I just want to again thank Florida Blue, the Florida Blue Foundation, Penny, Velma, Susan, Pat Garrity. They know when to press the right buttons, and they started pushing all of us before the pandemic that this crisis was coming. And so we're appreciative of them. Last thing, as I give it to Bob right now, if you're a business leader and you're watching this and you've been impacted by this crisis, your heart has been moved. Don't get off this webinar. In the next 60 seconds, message Bob, message Maggie, get a hold of Ron, put your name in the chat. We're building a leadership team right now that is going to impact this crisis and save lives, and you got to be a part of it. So Bob, I'm going to kick it back to you. I know we're close on time, but it's a privilege to work with you again, with Kathleen again. I love Fort Lauderdale. I love Broward County, and I know you guys are going to impact so many lives in the weeks and months to come.
Thank you very much, Andre. If you're like me, you've learned a lot in this hour that we all spent together. This is the ground floor. Today's business briefing was really to share with the business community what our intentions are, and that we are going to put together a leadership team that will have an impact, and we will have objectives that will measure our results in the years to come. I can't thank the leaders that are on this call enough for your work and joining us in Project Opioid. All of South Florida is coming together on this. Our partners in South Florida are the Beacon Council and the Business Development Board. Our partners in economic development, all three organizations have embraced this Project Opioid mission, and that we've got to work on solving this issue to improve the quality of work life and business life in Broward County and South Florida. So you'll be hearing, you'll see activities from our partners in the North and the South also fighting this issue. As Andre said, please let us know. Everyone on this call knows how to reach the Alliance. We want you to be involved, and this is going to be an important initiative. And I'll close with this. There are businesses throughout Florida that do amazing work. The one that we are very proud to be associated with, and this is just not today, yesterday, it's been for decades, and particularly the last 10 years in partnership with Dr. Penny Schaefer at Florida Blue. We really have to thank Pat Garrity and the leadership team at Florida Blue Foundation for taking on this issue, for reaching out to us. And Penny Schaefer knows that she can be a persuasive saleswoman, and she really reinforced that we need to work on this together. So again, thank you all for taking an hour out of your day today. I hope you learned a lot. I hope you're inspired to get involved with us. We will make a difference. And I look forward to working with the co-chairs and, of course, my counterpart at Broward, at United Way of Broward County, Kathleen Cannon. And a special thanks to Ron Drew and Maggie Gunther, the Alliance team, to help put all this together. Our next gathering will be in person. So this is just the start. We want to spread the word. We count on everyone on this call to help, or the Zoom, to help spread the word. But we'll be gathering in person as we formally launch Project Opioid Broward. Again, thank you for your time, and we'll be in touch soon.